Good afternoon, everyone, and I would like to welcome you to the 6th meeting of the Standing Committee on the Status of Women. I call this meeting to order. Pursuant to Standing Order 108.2 and the motion adopted on Tuesday, February 4th, the committee will resume its study of intimate partner and domestic violence in Canada. Given the ongoing pandemic situation and in light of the recommendations from public health authorities, as well as the directive of the Board of Internal Economy on October 19th, 2021, to remain healthy and safe, the following is recommended for all of those attending the meeting in person. Anyone with symptoms should participate by Zoom, not attending the meeting in person. Everyone must maintain 2 meters physical distancing, whether seated or standing. Everyone must wear a non-medical mask when circulating in the room. It is recommended in the strongest possible terms that the members wear the masks at all times, including when seated. Non-medical masks, which provide better clarity over cloth masks, are available in the room. Everyone present must maintain proper hand hygiene by using the hand sanitizers at the room entrance. Committee rooms are cleaned before and after each meeting. To maintain this, everyone is encouraged to clean surfaces such as the desk, chair, and microphone with the provided disinfectant wipes and vacating or taking a seat. For those participating virtually, I would like to outline a few rules to follow. You may speak in the official language of your choice. Interpretation services are available for the meeting. You have the choice at the bottom of your screen or either floor, French, or English. If interpretation is lost, please inform me immediately and will ensure interpretation is properly restored before resuming the proceedings. Before speaking, please wait until I recognize you by name. If you are on the video conference, please click on the microphone icon to unmute yourself. Those in the room, your mic will be controlled by the proceedings and verification officer. A reminder that all comments should be addressed through the chair. When speaking, please speak slowly and clearly, unlike I have in the last couple seconds. When you're not speaking, your mic should be on mute. I've got one more page of this, everyone. Before we welcome our witnesses, I would like to provide this trigger warning. We will be discussing experiences related to violence and assault. This may be triggering to viewers with similar experiences. If you feel distressed or if you need help, please advise the clerk. I would like to welcome our witnesses now, but I'm just going to say I do know that we're starting late, so just if the witnesses can give me a thumbs up on here. This meeting usually goes till 5:30, and your panel would usually be from 3:30 to 4:30. Would you be able to extend that time to 4:45? Would you be able to all remain with us till 4:45? Fantastic. Thank you so much. I really appreciate that. That will just give everybody a greater opportunity to speak to you. So now it's time to welcome our witnesses. On our first panel today, we have Statistics Canada, Lucy Leonard, Director, Canadian Centre for Justice and Community Safety Statistics, Kathleen Aucoin, Chief of Analysis Unit, Canadian Centre for Justice and Community Safety Standards. As an individual, we have Lena Wells from the Associate Professor, Brenda Stafford, Chair in Prevention of Domestic Violence, University of Calgary. And from the Centre for Research and Education on Violence Against Women and Children, we have Katrina Scott, who is a professor. Just let everybody know on our opening round, for our opening witnesses, that we'll have 5 minutes to speak. You're going to see me going like this to wrap it up. That usually starts about 10 to 15 seconds before, and we just ask that everybody is tight on their time so that everybody gets the best and optimal time. We're going to pass it over now to Statistics Canada. You have your 5 minutes for your brief. Go ahead.
Madam Chair, thank you, and members of the Standing Committee. I would like to thank you for the opportunity to present our most recent statistic on intimate partner violence in Canada. Much of the information that I would be focusing on this afternoon is available in several publications, and I've provided the clerk a complete list of these with key data points in a written brief for your reference. It is important to note that the data that I would be highlighting come from various sources, including police-reported data, as well as self-reported victimization surveys. Police data capture forms of intimate partner violence that meet the criminal threshold and are reported to police. However, as many of you are well aware, intimate partner violence often goes unreported to the authorities and includes a range of abuses. These include psychological, emotional, and financial abuse, all of which can be extremely harmful, but will not be collected through police data. As such, I will be drawing from both types of data sources to provide a full picture of the nature and extent of intimate partner violence in Canada. Overall, trends of intimate partner violence over the past 2 decades have declined. According to the 2019 General Social Survey on Victimization, spousal violence, that is physical and sexual assault, and the threat of violence in the provinces was significantly lower in 2019 than in 1999. Over this time period, spousal violence decreased for both women and men. Overall, trends for police reported data showed declines in intimate partner violence from 2009 through 2015. However, more recently, there have been incremental year-over-year increases. Specifically, the rate of police reported intimate partner violence against women increased 10% in 2020 from what was recorded in 2017. Similar increases over the same period of time were noted for men. Concerns about the impact of lockdown restriction during the pandemic have also been noted, and through a web panel survey conducted during the early months of the pandemic, 8% of Canadians reported that they were very or extremely concerned about the possibility of violence in the home. This proportion was higher for women than for men. To the survey of safety in public and private spaces, we measure lifetime experiences of all forms of intimate partner violence, including physical and sexual assault, as well as psychological, emotional, and financial abuse. According to this survey, 44% of women reported experiencing some form of violence by an intimate partner in their lifetime, that is, since the age of 15. In addition, almost 1/4 of women reported experiencing physical assault compared to 17% of men. Notably, women were 6 times more likely than men to have been sexually assaulted by an intimate partner in their lifetime. Women and some population groups are at greater risk of experiencing intimate partner violence in their lifetime. Indigenous women are at great risk of experiencing intimate partner violence in their lifetime. Specifically, about 6 in 10 First Nation and Métis women stated that they had experienced some form of psychological, physical, or sexual abuse committed by an intimate partner in their lifetime, as did 44% of Inuit women. Taken together, this represented 61% of all Indigenous women. Sexual minority people, those whose sexual orientation is gay, lesbian, bisexual, or another sexual orientation, are much more likely to experience all forms of intimate partner violence. For example, in 2018, 2/3 of sexual minority women had experienced at least one type of intimate partner violence since the age of 15. More than 1/4 of sexual minority women reported being sexually assaulted by an intimate partner at some point since age 15. In addition, more than half of women with disabilities experience some form of intimate partner violence in their lifetime. Almost 1/3 had been physically assaulted, while 18% reported being sexually assaulted by an intimate partner in their lifetime. More than 1/4 of intimate partner violence victims experience violence or abuse on a monthly basis or more frequently, and 1 in 10 women victims experience it almost daily. Measures of intimate partner violence often take into account the level of fears victims experience. Being afraid of a partner can indicate that experiences of violence are more coercive, relatively more severe, and more likely to reflect a pattern of behavior by an abusive partner. Compared to men, fear is considerably more common among women who experience intimate partner violence. Nearly 4 in 10 women who were victims said that they were afraid of their partner at some point in their life because of the abuse. The type of intimate partner violence experience is associated with the likelihood of being fearful. Among victims of intimate partner violence who experience solely psychological form of abuse, 12% of women and 4% of men stated that they had been afraid of a partner. In contrast, 55%
Excuse
of women...
me, Ms. Witness,
Yes?
I'll give you a couple more seconds. We're already a few minutes over time, or a few seconds already over time, so if you could just wrap it up in 10 seconds, and then we'll be able to ask you
Absolutely.
through the questions. Thank you.
Absolutely. And in contrast, 55% of women who experience physical or sexual violence fear their partner at some point. So thank you, Madam Chair and honorable member, for your attention this afternoon. And my colleague, Cathy Ocon, and I are happy to answer any of your questions you may have in French or English. Thank you.
Excellent. Thank you so much. And we just found out you wouldn't be able to see me because I'm on the one screen and it's not going directly at me. So I will have to interrupt you at the 5 minutes just to let you know that we're coming to that time. So I'm now going to move it over as an individual, Lana Wells, Associate Professor and from the Brenda Stewart Chair of Prevention and Domestic Violence, University of Calgary. You have 5 minutes.
Thank you. Can you hear me?
Sounding good.
Well, awesome. Thank you, Madam Chair and committee members, for inviting me important. It's a privilege to be here with you today. And I want to thank each of you for your service to ending intimate partner violence in Canada. I'm calling from the town of Canmore, Alberta, which is located within Treaty 7 region of Southern Alberta, and the territory is home to the Métis Nation of Alberta, Region 3. Since 2010, I've held the position of the Brenda Strafford Chair in the Prevention of Domestic Violence in the Faculty of Social Work at the University of Calgary, where I'm leading a research hub called SHIFT, the Project to End Domestic Violence. And the focus of our work is on preventing first-time perpetration and victimization of domestic and sexual violence by designing and scaling up interventions that target the structural and cultural conditions that produce and reinforce violence while trying to build the will and skills of individuals, families, communities, organizations, and systems to prevent violence. So over the years, our primary prevention efforts have focused on developing multi-level interventions that prevent teen dating violence, because we know that 1 in 3 Canadian youth experience violence, and that victimization during adolescence is related to re-victimization in adulthood. So youth that have experienced dating violence have a higher rate of experiencing domestic violence in adult relationships. So working with youth and the adults around them is a key strategy for violence prevention. We've also focused our research on supporting the transformation of the anti-violence sector to better serve and support informal and natural supporters, because we know only 12% of Canadians experiencing intimate partner violence go directly to the police. Most survivors and aggressors go to their friends, families, neighbors, and coworkers first. And in fact, research shows that positive informal supports lead to decreased risk of experiencing domestic violence, especially if that support occurs before relationships become violent, when initial problems or issues begin to emerge. So the importance of stepping in early with the right skills must be taught to all Canadians. For 11 years, our research hub has been designing, implementing, and learning how to engage and mobilize more men and boys in violence prevention and gender equality. We believe violence is a learned behavior, and if we want to stop violence, we must work with and support men and male-identified people. One of our most recent partnership is working with the Calgary dominated environment, where we are testing a nudge and social norms approach to get at the structural and cultural change, because we know policy and training are not sufficient to get at the changes we're all seeking. Since COVID, we've been digging in to understand how big data, artificial intelligence, machine learning, and predictive analysis can support prevention efforts. We're trying to leverage new technologies to monitor COVID impacts, to inform our response and recovery in real time, as we have no central repository of comprehensive cross-analyzed violence data in Alberta. As a result, we partnered with a collective impact organization that represents hundreds of anti-violence organizations and systems in Alberta to better collect data, but also to use the information to inform prevention efforts. Lastly, we're conducting a research project to better understand alternative justice approaches to sexual violence healing and prevention. By alternative justice approaches, we mean those activities and interventions that are outside of the criminal legal system, that are survivor-centered and trauma-informed, that promote prevention and healing with survivors and aggressors of sexual violence. At SHIFT, we believe that we need to be working on initiatives that create hope, healing, and opportunities to transform gender relations and norms, support accountability and repair, and are survivor-centered. We believe a non-mandated model that integrates reparative and transformative principles have the potential to meet survivors' needs, rehabilitate offenders, address injustice, and prevent future acts of violence. I'm super excited to be here with you today. As a committee, you have a very large and important mandate. And I'm hoping that our conversation will continue to motivate you to undo the systems of oppression that are hurting and reinforcing violence. That means focusing time, resources, and political leadership on the root causes of violence. And I know this task is daunting and overwhelming, but for us to end violence, we will need to dismantle white supremacy, patriarchy, colonialism, and racial capitalism, because they are the foundation that gives rise to individual and collective manifestations of violence. These systems have normalized inequality and systemic racism, put profit and exploitation over people's well-being, put individualism over cooperation and social cohesion, and normalize competition, aggression, and many forms of violence which we
5
don't
minutes,
often
10
recognize
seconds.
as violence. Thank you. Well, I'll end there. Thank you so much for the opportunity to be here, and I look forward to a robust discussion.
Sorry, and I hate cutting you off because I know there's so much information that you're providing to us, but we'll try to get all of that information to the questions. We're now going to turn it over to Katrina Scott with the Centre for Research and Education of Violence Against Women and Children. Trina, 5 minutes. Are on mute, so perfect.
I would like to, I too would like to give thanks to the committee for this opportunity. I bring greetings from Niagara, Ontario, traditional territory of the Haudenosaunee and Anishinaabe peoples. As introduced, my name is Katrina, and I'm the director for the Centre for Research on Violence Against Women and Children, which was one of 5 centers across Canada whose creation was prompted by the 1989 targeted murder of 14 women at l'École Polytechnique in Montreal. We've heard just now about the prevalence and impact of domestic and family violence. And it's true that ending these problems is going to require taking a number of actions, but there are clear pathways to change. We know that we need to make significant progress on gender equity with initiatives like national childcare and take it or leave it paternal leave. We know we need to continue public conversations about gender violence, and that these conversations need to include considerations around structural violence and intersectionality. And as my colleague Lana Wells just spoke about, we know that we need to do a much better job at prevention. What I want to talk about today is what happens when public education and prevention fail. What kind of response can Canadians count on? There will be many people testifying to this committee about what is needed to respond to survivors. And we know that one part of the answer is providing stable and adequate funding to women's shelters, sexual assault centers, and to other programs for survivors of abuse. But what do we need to do to address people who are engaging in abusive behaviors, who are causing harm to others? When Canadians are concerned about their own behaviors and their family and their relationships, where do they turn to get help? We have seen investments federally and provincially, territorially in professional education to make sure that gender-based violence is better recognized by healthcare providers, social service professionals, and by workplaces. These are welcome developments and changes. But again, who do people call when they want to make a referral to service? And what about the many Canadians who have a family member, a loved one, a colleague, or a neighbor who turns to them, who see degrading or abusive or threatening behavior? How do they get help for the person that they want to change? The reality is that finding help to address abusive behavior in Canada is really, really difficult. All Canadian provinces and territories have at least one program that specializes in working with those who've perpetrated abusive behavior, but in many parts of Canada, the only way you can access this program is by being arrested. This can't be the way that we want the system to work. And although all places have at least one program, mostly it's that, just one program, a short-term, group-based, one-size-fits-all intervention that in many rural communities is offered once or twice a year. We have known for years that one size doesn't fit all. There are many examples, but just to one, we know, we've known for a long time about the relationship between intimate partner violence and substance use. And despite many, many recommendations, we know that abuse is not caused by alcohol or drugs, but for those who suffer from addictions and also perpetrate abusive behavior, it's important to address these behaviors in tandem. And despite many years of recommendations, there aren't collaborative or joint programs available in Canada. Even if you can pay for service privately, you're going to be hard-pressed to find a therapist to do this work. So why not, and what can we do about it? Well, part of the problem is one of workforce capacity. It takes specialized knowledge and skill to work with perpetrators of abuse, to know how to have difficult conversations, and to help amplify people's discomfort with and concern about their behavior, to be able to track and access and address abuse and risk for abuse. This is not something that's taught in most psychology or social work or nursing or even psychotherapy programs. Most learning happens on the job. We did a survey recently of specialist service providers in Canada, And one of the things we found is that only 8% of current specialists who work with men who cause harm said that they were prepared when they started their job. Almost all of them reported that ongoing training that was available from their agency was also inadequate. So the federal government could develop and support workforce capacity. We just finished a wage-funded project based on collaborative work of service providers, survivors, and researchers from all Canadian provinces and territories to develop the Flourishing Practice Model, which is a framework that outlines the expertise of service providers in this area. The other thing that governments can do
If 5
is
minutes
make
is
the
done.
development and testing of a range of different intervention programs for perpetrators part of the National Action Plan. Thank you.
Awesome. Thank you so much. Just to let you know, so we'll be starting our first round. On our first round, each person will, or each member will have 6 minutes, and I'll give you the 1 minute warning so that you can wrap up in that 6 minute time. I'm going to pass the floor over to Michelle Ferrari. Michelle, 6 minutes.
Thank you so much. Thank you so much to all of the witnesses. Not an easy topic to have on a Tuesday. I think it's Tuesday, isn't it? Who knows what day it is anymore. I'd like to start out, and I'm not sure who wants to answer this, if all three witnesses want to answer this. It's mostly around statistics. So I'd like to know, emotional abuse during childhood has been shown to be associated with an increased risk of intimate partner victimization in adulthood. Are these statistics that address the correlation between emotional abuse during childhood and perpetrating intimate partner violence? Are there statistics around that?
Hi, thank you, Chair, for the question. I'm sorry, I'm hearing feedback. Is everyone able to hear me? Okay, thank you, sorry. There are key linkages between risk of being a victim of intimate partner violence and experiencing child maltreatment before the age of 15. So that could include harsh parenting, observing or witnessing violence within the home. So from a child's perspective, if the home front had those behaviors, the understanding is as an adult that this is acceptable and this is norm. So there are key linkages. In addition to that, we also know that children who have been exposed could be a victim of other forms of violence outside of an intimate partner relationship. So there's definitely some key linkages to that.
Sorry, I hate interrupting. I always feel so like we're rushed because we have such limited time.
Sure,
I'm just wondering if there's, sorry, can you hear me okay?
I can perfectly.
Okay, great. I'm just wondering if there's specific stats around that, and if there is, can we table them for the committee?
Certainly.
Fantastic. I'm also looking around stats on men. Is there any stats right now that you have, and again, I would ask them to be tabled to the committee, on men who know what intimate partner violence is, starting at a younger age?
We have no data to that specific question. What we do have that I will send your way, with the Survey of Safety in Public and Private Spaces, we asked a series of questions about attitudes towards gender-based violence, very generic. And we broke it down by male and female and whether their perception of those statements were supportive or not. And I think that would touch on what you're getting at, and we could supply the committee with that information.
Thank you. That would be super helpful. I'm wondering if, in your research or in your statistics collection, do you break it down into age, socioeconomic class, ethnicity?
We can. For the first report, we didn't do a deep dive. Those are great questions, but we can definitely produce it for you.
Fantastic. This question is to Katrina, I believe. Katrina, were you the last witness that spoke? I always want to make sure I have the right people. I have a sheet in front of me and I want to make sure I have the right. Yes, fantastic. You talked a lot about having people working in this field to help and lived experience and sort of learning on the job. And I'm curious if you've looked into having men who have restored or have the lived experience, whether, have come out on the other side of working in this.
Yes, absolutely. I think those voices are important. The work that we did to develop the workforce capacity framework involved as core partners survivors of intimate partner violence, we didn't make as core partners for this work those who have engaged in abusive behaviors. However, many of the conversations were vetted by men who had many years of experience working with men and for whom that kind of feedback is part of continual improvement of the program.
Thank you so much. Another question, not sure who wants to answer this one, another stats question. Do we have any stats on the difference between rural versus urban violence, intimate partner violence?
We do. And in the packet, we provided one table. I also have another table in the office that I can send that compares 2019 to 2020. We know that intimate partner violence for women, the rates are higher in rural Canada than urban areas. And when we think about rural, we need to be careful and not think of rural as a one fits all across Canada. Every province has a different community, and rural in Quebec will be different from rural in Ontario, Saskatchewan, Manitoba, where the highest rates of intimate partner violence against women are in the territories, as well as rural Alberta, Saskatchewan, in Manitoba.
Thank you. And I know we don't have a lot of time left, but
5 seconds.
45 seconds. Just in terms of what you think would be effective in connecting to educating young males on what a healthy relationship would be.
I would defer to the experts on the service providers who know policy and program.
I'm happy to jump in on that. I think Canada has been investing, particularly trying to scale up, where they're actually targeting grade 7, 8, 9 boys to do gender transformative and human rights work so that they can be woken around their own experiences of socialization around male norms and healthy relationships and gender equality and equity and so forth. And I think investing in targeted and then all gender classes are critical. So the content has to go into curriculum, which I know the federal government doesn't have a responsibility. Provincial governments do, but I think you can encourage governments to take up this kind of curriculum, as well as in teacher education programs to ensure it's embedded to the teachers that are being trained. And then, of course, to support, I think, all genders. And then
thank you very much, Mrs. Wells. We do have to move on to the next questionnaire. Sorry about that. We're now going to move it on over to Sonia Sudu. Sonia, you have 6 minutes.
Thank you, Madam Chair. Thank you, all the witnesses, for your testimony. My first question is to the team from Stats Canada. Your brief notes that you'll be doing another round for the data collection in 2024. Can you speak to any gaps that you think may exist in your data and research and how that may be improved moving forward, if you feel any kind of gaps?
That's Chairwoman, a great question. I think Statistics Canada has done a great job with funding from our partners monitoring intimate partner violence over the years. Where we understand the gaps to be are immigrants who don't speak English or French, new immigrants, because they would not be captured in our household surveys. In addition, they might be reluctant to report to the police. So that would be a qualitative study. And I think complementing qualitative studies with our quantitative studies really tells the full picture. When I think about long-term issues, what we hear from shelter managers is shelter use for victims of intimate partner violence has not gone down. So there's a constant need. And what we hear from managers of shelters is that women leave often to their abusers. It's not because they want to go, because there's not enough adequate housing. So that structural issue has been there for more than 20 years. So if someone doesn't have a place to go to, they're stuck in a circle. So qualitative and quantitatively exploring victims of intimate partner violence and what they need to leave the abusive situation is a gap. And again, that's a qualitative study, from my opinion.
Thank you. And next question is for Ms. Scott. What sort of mental health supports are available to women and girls who experience intimate partner violence, and which method have proven to the most effective because their mental health is more impacted than anything else? What do you think about that? Ms. Scott?
Yes, sorry. Yeah. So when survivors of intimate partner and domestic violence, they turn primarily first to friends and family, and then they turn to and can access supports through shelters and through women's advocates. One of the things that's so important about the work that shelters and women's advocates and sexual assault centers do is that they center the identity, they center the strengths, they center the needs of the survivors. And in that way, they recognize the impact of violence as not an individual mental health problem, but recognize the impact of violence on that person and are able to work around mental health issues through that trauma and violence informed lens. And having that lens is very important. And it's a very important start point for dealing with mental health problems, if you want to call them that are a result of experiencing violence and abuse.
Thank you. Ms. While marginalized women experiencing intimate partner violence can face specific barriers in accessing service and justice, could you tell us how stigma and biases affect women and individuals from the diverse background when they're trying to seek support following experience to intimate partner violence because their language barriers? And you also talk about the prevention efforts, new technology, artificial intelligence. What do you think? How can it's more effective to them?
Thank you. Great question. I think equity deserving groups have been left out of the mainstream services for quite some time, and lots of community organizations and associations, I think, from a grassroots do a great job in servicing, but I don't think the mainstream services have taken up enough, I would say, capacities to actually transform their own services to better serve the unique populations that you're talking about. And not only the forms of violence that are experienced, but they're experiencing discrimination in the workplace, systemic discrimination and racism, as you mentioned. And so I think those are the issues that if the committee really wants to go upstream and to be thinking about the root causes, we have to start unpacking those systems, how they're showing up in our culture and our structures, and then rethinking those to better serve all populations in Canada.
You have 1 minute.
Okay. Just wanted to, Ms. Scott, do you want to add on that? Anything?
I would love to if I could, because one of the things that I think is really important is creating services within, adding to what Lana says, within culturally specific and culturally led organizations that can work in an integrated and alongside way with other services. And there have been some really well-developed services in that way that address and recognize migration and pre-migration traumas and experiences, and as Lana says, the ongoing impacts of racism and discrimination, and all of those do need to be taken into account. And when we can bring that strength within the cultural organizations and culturally based services and work alongside mainstream, I think that we get the best of both worlds.
And thank you. And the Caring Dad program, you want to talk about in a brief? What is that?
About 10
Caring
seconds.
Dads is one of those other programs around what other needs do we have? Can we do something other than just one program? So Caring Dads was a program we developed to meet the needs of fathers who have perpetrated violence and abuse in their families, and that may be toward their children or towards their children's mothers.
Thank you very much. We're now going to move over to 6 minutes, and Christine Normandin, you've got the floor for 6 minutes.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Chair. Thank you to the witnesses for being here today. We greatly appreciate it. And hopefully one day it won't be required because we won't need to study this kind of issue anymore. My first question is for Ms. Wells. You talked about restorative justice programs, and there's an organization in my riding that works with teenagers. And I had a question. Sometimes we might think that it's easier to work with someone who's younger for that type of justice. Could we apply that to people who are a little older, to perpetrators? Could that work? And would it be a good thing for the victim as well?
Yes, and thank you for raising that, because I truly believe the answer to resolving and preventing the domestic, intimate partner violence, sexual violence is in a reparative, transformative way that is actually outside the criminal legal system. And I think the federal government can play a significant role in supporting this stream of funding and services and an adaptation and adoption from multiple stakeholders across Canada that are trying to do this kind of work in community, which they're working with the victim, the survivor, and it's driven by the survivor. It's in support of, they're calling it the aggressor, not the perpetrator. And it's around not just supporting the both of them, but their family, communities, and support systems to be healing and repairing, and then advancing social justice and change. And we've been doing a big research project, and there are groups like Women at the Center out of Toronto. There's some groups, I know Dr. Joanne Wemmer, who's a specialist in this out of Montreal. So there is great stuff happening in Quebec as well. And we've been linking people and a lot of First Nations and Indigenous communities who are doing this work together right now to see how can we start to create a series of principles and practices and training and start to think about how we can move to this type of, this ways of working. Because I think we all want repair. And I've been working 11 years engaging men, and often a lot of them have hurt in their past or have been complicit in violence, but they are healing and growing and changing and want to work with other men to heal and grow and change. And we need to support people on this journey.
Et je vois que Madame Scott
And I see that Ms. Scott seemed to have something to say. So you mentioned that one of the issues is that we have to wait for someone to be arrested before looking at alternative means. Are there any options that could help us work upstream to start the process?
Je m'excuse que je ne peux pas répondre en français.
I apologize, I can't respond in French.
I think it's when we think about restorative justice, we often again think about some sort of intake through a justice process. I think what I want to do is think much more broadly about opening as many doors and as many pathways as possible. We need to intervene as early as possible with these models. We need to do repair way upstream as soon as somebody is engaging in abusive behavior. We know that only 12% of abusive behavior gets reported to police. We know that people experience a lot of violence before they call the police. So for me, the location to do this work is as early and as early upstream as possible. And I don't want the restorative justice models to be linked and at the end of the process. They need to be at the beginning.
Est-ce que vous pensez que ça pourrait être...
Do you believe that it could be interesting to create these programs whereby victims know that they're not making a complaint that will lead to an arrest? Sometimes that could stop them from reporting, but they could instead make a complaint and hope for restorative justice instead.
And I think we can do this. I think that we can create a system, we can create responses that are flexible, that meet people's needs, and that create a web of accountability for people who have caused harm, that keep people in view while we work and we center the needs and the safety of survivors. That kind of system would close loopholes and the kind of gaps that end up implicitly condoning the actions of perpetrators by letting them feel victimized or vindicated by the system, or that end up putting the burden on family members and on victims and on neighbors and communities for the risk and for the harm that's being caused.
Merci beaucoup. Maintenant, une question peut-être.
Thank you. For Ms. Leonard, in your statistics studies, do you also examine coercive control? Have questions been asked on that type of behavior?
Thank you for the question. In the survey of safety in public and private spaces, we did ask for from respondents whether they had experienced any emotional abuse, and some of it was controlling. For example, did your partner blame you for the violence? Did you feel trapped? And some of these key indicators get at that sense of coercive control. We never asked respondents specifically, did your partner coercively control you? But we asked a series of other questions to get at those behaviors.
Okay. Mais c'était toujours en lien avec un événement.
So that was always linked with an element of violence, physical violence, for example.
We did more than that. We had physical violence in several behaviors just for physical, several behaviors for sexual, and then several behaviors for emotional and psychological abuse. And so it did not have to include physical violence.
Awesome. Thank you so much. We're going to pass it over now to Leah Gazan. You have 6 minutes.
Thank you so much, Chair, and thank you to the witnesses for your excellent presentations today. My first question is for Lana Wells. You mentioned something very interesting to me. You said that white supremacy, colonization, and capitalism, you mentioned those 3 things specifically and associated it with increased rates of violence. I'm wondering if you could expand on that.
Sure, and thank you for the question. If we think about the systems of oppression, how we've organized ourselves around these grand narratives. And you can see it play out in systems and processes. And I think one example I can say, as the federal government is moving to give child welfare authority back to Indigenous communities, that's a way that you're dismantling colonialism, right? And so thinking about these, not only grand gestures, but supports, enacting the United Nations UNIDRIP to support the implementation of Indigenous rights. I think those are the conversations that I think Canada is having, and it's critical that we really reflect on our positions and positionality. And so thinking about even the universities, all of our systems and structures, we have these processes and policies that are embedded that actually, hurt, I think, marginalized people and continue to hurt women as well. And so as we think about advancing gender equity, as we think about breaking down systemic racism, I think these are the conversations that Canadians want to have. And I think we need to change our systems, the way we organize our policies and laws, because they're not supporting, I think, ending domestic or intimate partner violence. And just to loop back to the coercive control, I think there's a lot of advocacy going on to get this into our criminal code. And as we think about coercive control, it's a really important definition. It helps us understand.
Just because it's my time for questions,
Sure,
I want to use it. Sorry. Not that I'm not interested. You mentioned a little bit about incarceration. I believe it was you. I've done some work with jails when I taught at the university, and one of the observations I made was that it's very difficult to teach pro-social behavior, to teach behaviors of nonviolence in an antisocial, very violent institutions. I'm wondering if you agree with that. And speaking to, of course, alternative justice approaches, although agree with prevention as a better way to mitigate issues or eradicating violence. Thank you.
Yeah, I think definitely. Yeah. And I also think certain populations get over-policed in Canada, right? And we are working closely with the Calgary Police Service and have been for 2 years, that we're trying to change the discrimination and bias that happens within policing so that they can better, support the Calgary community. And I think policing has to be modernized. Police acts have to be modernized. And so I think a lot of people in Canada are up for the challenge to start dismantling these systems that are hurting particular populations.
Thank you so much. I want to move to Madame Scott. I agree with you. Getting help for individuals who display abusive behavior is difficult and often unavailable. And I'm wondering if you could share how the barrier to get help is limiting our ability to really address this crisis of violence.
Perhaps the best example, I think the best response might be an example. One of the really positive things that happened over the pandemic is Nova Scotia managed to put into place with some collaborative agreements, something called the Men's Helpline. It was a broad general line aimed at men. The messaging was around life can be tough, you can get help. There was a massive and they ran it through 211. So they ran it through a general service and saw a massive uptake in the number of men who were calling. We did some analysis of the reasons men were calling, and there were a number of reasons, but one of the main ones had to do with anger and abusive behavior in relationships. Men may not have been calling to say, listen, I'm being abusive, but that what they were calling to say is, I'm really angry. I'm having these problems. I'm worried about what might be happening in my relationship. My partner asked me to call, and they were reaching out for help. So when we create these opportunities, people will reach out and ask for help.
Thank you. Thank you very much for that. And just expanding on that, you spoke about the need to include it in the National Action Plan. I agree with you. We often look at one side of the issue and we don't look at the cause. You also looked at prevention so that we don't have to use alternative justice strategies, that it's dealt with before there's an issue. Can you please expand on that very quickly? I think we have how much time?
You have 30 seconds.
Okay, thank you.
What I want to do is just draw connections between the kind of model that Lana and I have both talked about that brings people together to do some reparative work, and point out that we need to do that right before, right? We need to do that so that when men call, we can start to respond in that way. That when neighbors say there's a concern, when workplaces identify that there is somebody in their workplace that they're concerned about abusive behavior, we can put that model into place right then.
Awesome. Thank you so much. We're now going to move on to our second round. Those are 5 minutes. So we're going to start off with Leila Goodridge. Leila, you have the floor for 5.
Madam Chair, I just want to really briefly touch on a question that was asked by my colleague, Ms. Ferrari, earlier regarding rural versus urban. And I'm just wondering if any of the service providers, possibly other than StatsCan, because we do have their data table, so not looking for more answers from StatsCan on this, but does anyone else have any answers in regards to the why behind rural versus urban and the difference in abuse?
I can start if that's okay. One of the reasons is that there's a surveillance effect of having neighbors and friends and family and workplace and colleagues. And in rural areas, there is less people around to watch. There's also more barriers to getting help. There's more barriers around everybody knowing everyone. And as somebody gave me an example earlier, if I park my car outside of the shelter, everybody knows that I'm in the shelter. And that has a lot of judgment associated with it in that community. So those are two reasons.
Are there stats? I'm wondering if there's any stats, and if you have stats, if you could just table them with the committee, that would be spectacular. And then to go into a totally different space. In the Missing and Murdered Indigenous Women Calls to Justice 5.24, it asks. It gives a recommendation to call on the federal government to amend data collection and intake screening processes to gather distinctions-based and intersectional data. I'm wondering, what has StatsCan done to implement this call to justice, if anything?
This one I can respond. We're working very closely with CERNAC in terms of the federal pathway in response to the national inquiry. There's different call for justice, as was mentioned as part of this committee. We've tackled one in particular in terms of moving forward with the Canadian Association of Chief of Police to have more consistent reporting mechanism and information on missing Indigenous women and girls and 2SL LGBTQIA people and other missing persons. So this is one of the call for justice.
I appreciate that, but I'm asking about that specific call to justice, if anything has been done by StatsCan to increase that intersectional lens on data collection. If you don't have the answer at the tip of your fingers, you're more than welcome to table an answer with the committee.
Yes, we will table more information because, as you know as well, we do have a specialized center on Indigenous statistics, and we're doing some work. And Cathy, if you want to comment on that.
Thank you. And now I'm going to share the rest of my time with Madame Bien.
Merci beaucoup à vous toutes.
Thank you very much for being here today. A couple questions for Ms. Scott. Is there enough assistance for violent men and boys in Canada? And do rehabilitation programs work? And perhaps we could have a better answer if we had statistics on the number of relapses. And another question, a child who is a victim of violence or saw violence in the household, would that person be more likely to become a victim or a perpetrator?
Okay, let me take those in reverse order. Absolutely. Adversity in childhood, that includes all forms of violence, including things like losing a parent or having a parent have a major mental health problem or a substance use problem or be incarcerated, are associated with later victimization for women and perpetration for men, both, but more often perpetration for men and victimization for women. So that's one. In terms of relapse, yes, we do have information. We don't have as much information as I think we need. We know that when abuse is identified, that there are about somewhere between 1 and 2/3 of men who go on to not engage in any subsequent abusive behavior. We know that there is about 1 in 5 who engage in a subsequent abusive behavior, often very quickly, often more severely, and often within the first 6 months. So we know there's a range of change that does happen. Yes, change does happen, and there are people for whom that change doesn't happen. We know that their engagement with systems after that has been recognized, and that could be any range of systems, predicts less reassault.
Madame Scott, en terminant rapidement, est-ce qu'on a assez au Canada suffisamment de services pour les...
Are there enough services for men and boys in Canada? Quickly.
Sorry about this. I'm going to have to interrupt because I know two mics don't seem to be able to go on at their own time, but we're past the 5 minutes, so I'm sorry about your time. What we can do is there was the GIST question asked by Dominique. If there's a possibility of any written reports coming in that would be greatly appreciated. I'm now going to pass the floor over to Anita. Anita, you have 5 minutes.
Thank you very much, Madam Chair. And my first question is to Ms. Leonard, although if others wish to answer, please go ahead. And it's pulling on something that you said, and I want to make sure that I heard it correctly, because we very often, for obvious reasons, look at men as the aggressors or the perpetrators. But in your testimony, you said that 17% of men have faced physical assault at some point in their lifetime. So my question is twofold. First of all, in their lifetime, what would be the breakdown in terms of perhaps in childhood, or how many of them would have faced that in a conjugal relationship? But the other thing that I'm wondering is, because so much of it is self-reported or reported to police, is it possible there could be an underreporting as well because of social norms and stigma, and the perception of men and strength maybe being something that would cause many men not to be reporting either to police or also in the surveys that you're doing? Thank you.
Madam Chair, that's a great question. So 17% of male respondents had said in their lifetime they had experienced some form of intimate partner violence, and that was from the age of 15. You are correct. Many victims of intimate partner violence do not report to police for a number of reasons. Shame, feeling that it won't be taken seriously, concerns about disentangling the financial relationship, children involved. In addition, we also know that men are reluctant to turn to police for a multitude of reasons. Every year, we do publish a lot of data from police-reported statistics outlining the number of men and women that were victims of intimate partner violence. And we can look at the data from police and determine whether it was a same-sex relationship or an opposite-sex relationship. We tend and we insist on monitoring the impact of intimate partner violence on both sexes because they're both at risk, though women are at greater risk for more severe forms of violence and more sadly lethal.
Well, thank you very much for that answer. And just to follow up on that, there would obviously be other groups that would be less inclined to self-report or to report to police, particularly if, and I know that many of the witnesses talked about norms, but if they're in a group where perhaps something is normalized, that violence might be more normalized, and therefore they might not even consider that what is happening to them is violence or abuse. And in particular, I'm looking at financial and economic abuse, where, in particularly depending on age groups, certainly older women, but others might think that a man controlling the finances is normative and not something that would signal abuse. So if you could talk a little bit about the limitations of self-reporting in terms of data, and how to then ensure that people understand, and I also noted that teens were mentioned, that they understand what is abuse, what are the things to look for, and if something is happening to them, being able to identify it as abuse in order to be able to report it.
Yeah, again, wonderful question. So when we try to measure financial abuse, what we ask are a series of behavioral questions, rather than simply saying, do you think you were a victim of financial abuse, which means the respondent has to label what they've experienced as abuse. In fact, what we say controls your income, restricts your access to your income. And when we look at those behaviors combined, then we label it as financial abuse. And similarly, we do that for other physical and sexual assault behaviors. We had 28 different forms of abuse. And when someone checked off yes, then we classified them as being a victim. And in fact, what we believe is if we simply said, do you think you were a victim of emotional abuse? They would have probably said no. And again, there's a lot of cultural norms, as you say, and whether they think that that is just the norm. And thinking about child maltreatment, if they grew up in an environment where that was accepted, then anyway.
You have 15 seconds, Anita.
I'm sorry, I wanted to make sure the professors got a chance to answer as well, but I guess perhaps...
No, I'll give it 15 seconds for the professors. Go for it.
Okay.
One of the things that I guess I will say is that, yes, there are absolutely limits in self-report data. I think it's important that we combine self-report data with information from communities, with qualitative information, with police report information. In all cases, there are some pretty clear trends and findings.
Awesome. Thank you so much. We're now going to turn the next 5 minutes over to Christine. Christine, you have 5 minutes.
Merci. Je croyais que c'était 2 minutes et demie.
Thank you. I thought it was 2.5 minutes, but if I'm given 5 minutes, that's great.
Back. So yes, sorry, Christine, you get 2.5 minutes.
Merci beaucoup.
Thank you very much. I would also like to talk about the limits of self-reporting. Some people might be concerned in filling out surveys with StatsCan. Is there a way that it not be saved in someone's history? Or that would be my first question. And my second question, if somebody's going to fill out the survey, is there a way to do a confidential follow-up so that the person can have access to the necessary resources?
I have to turn, unmute.
Thank you. Wonderful question. When we developed the victimization surveys, we took a lot of care and concern about respondents. So 2 strategies were used on the individual's computer. So they would follow a link, Statistics Canada, and the questions would come. And there was a help button. So if someone was concerned about their safety, that perhaps their partner was in the room, they would click that button and they would pop out and go to some other homepage within Statistics Canada about cow purchases. I can't remember what it was. Secondary to that, we also added at the very end a list of victim services, call centers, if anyone was in need for help. For the telephone interviews, we trained interviewers to detect if there was a change in patterns from the interviewer and the respondent, that perhaps they were now being reluctant to share stuff. And the interviewer would say, is this a good time or a bad time? In addition, they also offered respondents links to different victim services. So we took a lot of care. We would never follow up in a secondary survey to ask additional questions. Everything was anonymized. So once you responded to the survey, there was no way for us to contact you again because your first, last name would have been stripped from the data file.
Thank you very much. Now we're going to move it over to Leah. Leah, you have 2.5 minutes.
Thank you so much, Chair. My question is for Madame Wells. Part of the shifts or recommendations that came from SHIFT was the need to fund and support Indigenous community leadership in developing and implementing initiatives that focus on traditional healing and holistic approaches. I know there's a number of men's groups, community-driven men's groups that have popped up in Winnipeg, proudly in the riding that I come from, that focus on men's healing, rooted in culture, rooted in decolonization, and reviving traditional responsibilities for Indigenous men. And it's seen some good positive results, but I'm just wondering if you could maybe share some examples or speak to the need for those kinds of initiatives and to support those kinds of initiatives.
Yeah, we're working with Indigenous elders here and Indigenous scholars to lead circles of support. And I think these need to be Indigenous led and supported. And I hope more funding and support will go to Indigenous communities as well as immigrant and racialized communities, because a lot of the support happening for men by men happens in community and through peer support. And we know that's quite an effective near peer model. And so I hope that continues to be invested in.
Thank you so much. My last question is for, StatsCan, either one, Leonard, I think it's Okia, or I can't pronounce the names. I'm so sorry. I'm embarrassed. But you spoke about how certain groups, Indigenous, LGBT, or sexually or diverse gendered and individuals from the disability community were at higher rates of experiencing violence. I was wondering if you could identify very quickly the top 2 factors that made certain groups more at risk.
You have about 10 seconds.
Great question. When we've done regression analysis, one of the leading indicators to victimization as an adult was experiencing child maltreatment. And that's when we were controlling for economic factors, ethnicity, age, and income. And that was not just intimate partner violence, but overall violent victimization. And I can send you some reports.
Thank you so much. On behalf of the committee, I would like to thank all of the witnesses today. I know that many of you, we have asked for specific information, so if you could send that documentation on to our clerk, I know I'd really appreciate it. And on behalf of the committee, thank you very much for your time today. We are going to suspend for just seconds here because we're just going to switch over to our next panel. And I would ask our panelists now that you would be able to leave if you wish. Well, leave. Thanks. Have a good day.
Thank you.
des maisons pour femmes victimes de violence conjugale. I would like to thank you for coming today. We have Chantal Arsenault, who is the president, as well as Louise Rendu, the co-responsible political issues. So I'm going to pass the floor over for 5 minutes to the recruitment. You have 5 minutes.
Alors, bonjour, mesdames, messieurs, merci.
Hello, everyone. Thank you for inviting us today. We read the reports very closely, and we examined coercive control in different countries. We believe that Canada should study Bill C-202. And we need to examine coercive behavior, and this needs to be recognized in the different facets of law. We need to recognize the impact of that behavior. This would allow women to have access to compensation as victims. The perpetrator would be held accountable for their actions. In Ireland, Scotland, in 6 American states and Australia, they are currently trying to adopt regulations on coercive control. The Scottish approach seems the most interesting to us because they recognize the importance of coercive control and the impact on people and children. For the countries that criminalized coercive control, well, they've shown that there needs to be training of all professionals, including judges, so that they can recognize it and recognize stereotypes in looking at the evidence. There needs to be an intersectional lens and a lens focused on Indigenous people and marginalized groups so that these groups are not disproportionately impacted. Assisting victims and resources is essential, just as essential as educating Canadians. And in Quebec, there are many shelters. 44 of them in Quebec assist women fleeing a violent partner. Women are assisted in the legal process in looking for housing and other. There are also activities organized in schools and in communities to focus on prevention. In Quebec, we have noticed that there's not enough space in shelters in Montreal, La Naudière, and other areas where it's in fact impossible to find a space. We need resources for housing, but also a proper budget. With the pandemic, we've noticed a significant increase of responses on the phone and external consultations. A shortage of workers is among the main issues. An increase in transfers to the provinces could help them to better fund resources and allow them to review programs. There are economic issues as well for women trying to flee their partners. They need to have access to affordable housing, social housing that is also safe. They need to have access to decent income and integration services. Immigration status as well is very important. In sponsorship, for example, there are different situations that keep them from fleeing. They need to be able to be autonomous and have access to language courses. Preventing violence means that we need to focus on children and young people and do better awareness raising. We could meet with students with different approaches, and for victims and their perpetrators and their close ones. If there is no physical violence, people might not necessarily recognize spousal violence. That is why awareness campaigns are important. They need to show the different aspects of coercive control, and this information needs to be shared regularly. Thank you.
So much. Oh my goodness, my buzzer. You were right on time, that 5 minutes. So what we're going to be doing is we're going to be starting going around in our first round. That will be 6 minutes each. I will be starting off with Dominique. Dominique, you have the floor for 6.
Merci beaucoup, Madame Arsenault.
Thank you very much, Madame Arsenault. And your colleague, whose name I can't see, I forgot my glasses, Miss Riendeau. So you raised a lot of elements.
Ça arrive, ça. Excusez-moi, mon Dieu.
That happens. So yes, I'd like to start with the beginning, because if we want to act, we need the money to do so. You mentioned having an appropriate budget. Earlier, somebody was talking about urban versus rural services. You have 44 shelters in Quebec. Please talk about the services that you offer and the funding that you need. Are you lacking in funds currently? Answer: yes, we have 44 shelters throughout Quebec, and indeed, the urban and rural realities are very different, and we would need better funding. We know that shelters are important, and the phone services have increased. We need to have teams in order to be able to respond to all these calls, but there also needs to be more awareness and training. Our partners need training on domestic violence, how to assess the risk level, and we want to be experts in that. We need funding for those. I imagine that you're currently receiving some funding from the government of Quebec, but are you receiving any funding from the federal government to support your shelters? Answer: no. The funds come from the province of Quebec for our members and for other women's shelters. We would need about $143 million. That's not what we're currently getting. So we're lacking about $30 million. That's why we say that there needs to be an increase in transfers from the federal government to assist the provinces. From the federal government, we receive money for the pandemic, but it's not any regular funding. Okay, so you take in women and children And you said that you don't have the means to do awareness in schools, but in your shelters, when you see children, how could you perhaps work with them? Earlier, experts were saying that there's a link between when children go through domestic violence and that could cause the child to become a victim or a perpetrator in the future. What kind of work could you do in your shelters with those children? We want to have an adapted approach to each child. Children who arrive in our shelters are in shock often. They heard what happened or saw what happened. So we try to give them the space to be children. We try to translate what they've seen and what they're feeling to validate what they're feeling. And in working that way, we allow children to understand what is good and what is wrong and allow them to make better choices. With teenagers, they see these strategies and they can see it clearly when we take the time to give them the information, and that can make a difference. And we also work on social stereotypes with the children arriving in our shelters. Earlier, you said that there were situations in which women have a hard time fleeing. Would you say that economic factors are among the most significant factors? Or is it the most significant factor, in fact? Answer, yes. At the beginning of the pandemic, we created a survey, and a lot of women said that they didn't ask for help because they were afraid of not finding housing. And having access to income and housing are essential conditions. There are some women who are completely discouraged because housing is too expensive, and so they had to go back to their partner. These are very important factors. We also talked about justice and psychosocial support, but we need to work on those social aspects to help these women. In Australia, when a woman leaves a shelter after fleeing violence, they are given up to $5,000 to find somewhere to stay. I would have liked to hear what you thought about coercive control, but perhaps my colleagues will be able to ask you that question. Thank you.
Thank you very much. I'm now going to pass the floor over to Emanuela. Emanuela, you have 6 minutes. Can you hear me? Okay. Emanuela? Good.
Yes,
okay,
my apologies.
Okay, 6 minutes.
I thought it was second. I apologize for that. Donc, un grand merci à nos témoins qui sont ici avec.
Thank you to our witnesses who are with us today.
You are second. I am so sorry on this. I'm just like Dominique. I should borrow her glasses. You are second on this, Emanuela. So it is with Jenna. I'm going to let you guys decide how to roll it, but it's either you or Jenna. That's my fault. Sorry.
Feel free to go ahead, Emmanuel. You had started.
Okay, so I don't mind continuing. Donc, un grand merci à nos témoins qui sont.
So thank you to our witnesses for being here today to help us with our study. We are currently trying to see what should be in the next budget, and that's why we're examining recommendations. I would like to know, are you aware of amounts that were in the budget of 2021? I know that a lot of that funding was allocated for the pandemic, but are you aware of existing programs for shelters? And also, do you think that these funds could be better spent if they haven't been used? Because we are trying to find better ways to spend this money. So if you know, what would your recommendations be for any better programs? Answer. We heard a lot about the special funds for the pandemic, and there's also funds through women and gender equality. But if I had to invest, I would invest in the education of the public and young people. And in educating Canadians, we want victims and perpetrators and family members to be able to recognize violence. Sometimes, if the violence isn't physical, then people won't recognize the spousal violence. And sometimes women were killed by their partners and they didn't ask for services. So I think that prevention is key if we want to get out of the situation that we're currently in. Thank you. Another issue, and I think that you referenced this during your opening remarks, a lot of women are looking for help. They leave the situation, but then they go back because they don't know where to go. And because they don't have enough money, they go back to their partners. So would it be important for the government to also invest more in housing for women, specifically for women who are fleeing? Answer. In our shelters, there are women who have gone through the legal process, who are ready to leave the shelter, but they have to stay because they are waiting for social housing, and this social housing is not very readily available. So there needs to be more options for women so that they can have access to affordable and safe housing. Thank you. And you talked about the education of young people. I think that it's very important. And I'm a former teacher, so I do understand the influence that we can have on children as teachers. Generally, education is a provincial matter, so how could the federal government support the school system and work on prevention? There are a lot of programs, but they would have to offer greater support because sometimes teachers are not comfortable raising these issues. So perhaps we could support workers in those fields. I think that we could also have more targeted programs and perhaps use social media so that we can reach children and teenagers beyond the schools. So that could be part of the health transfers and work and be sent to workers who work with young people. Thank you very much.
Minute left.
Okay. Puis dernièrement, est-ce que...
And last question. In your 44 shelters, do you know, for immigrant women, for example, I know that, of course, language is a barrier and culture is a barrier too. These can be barriers for getting access to services and reaching out for help. You only have 30 seconds, so I realize you don't have a lot of time to answer, but do you have any recommendations for how we can help this specific group of women? Answer. one of the main issues is status. Often these women are sponsored. And it's important also for these women to have an income, because most of the time they don't. They need the financial means to flee a violent situation. And so immigrant women have even more difficulty leaving.
We're now going to move it over to Christine. Christine, 6 minutes.
Merci beaucoup. Merci beaucoup à nos témoins d'être présentes aussi. C'est vraiment intéressant de vous entendre. Vous avez...
Thank you. And you talked about Bill C-202, and we'll talk about it in the House. We've talked about it in the House. The issue of coercive behavior. What happens if we adopt the bill, but it stops there? So we'll criminalize something, and then the issue will disappear. What needs to be done on top of that? You talked about shelters. You talked about the training of professionals who will be receiving complaints. Is there anything else that we need to think about when you want to change the legislation to have a real impact? Answer: yes, there needs to be training for professionals, including judges. I know that there is a bill on training for judges in the case of domestic violence. This happens often in private, and there's stereotypes. Earlier we talked about a man controlling finances. Is that a controlling man, or is it normal? So it's hard for professionals to understand these different situations. They have a hard time gathering the evidence. So there needs to be better training so that people can better detect and understand the issues, and so that they are able to do their job. But we also need to educate Canadians, because often friends and family would be the first to recognize violence, and they could help. So we need to help them identify everything. So criminalizing it is not the magic solution. You also talked about funding. Could you tell us what the impact would be of having recurring funding and having some foreseeability in shelters? Answer: shelters are open 24/7, every day, 365 days a year, because every day there are women and children whose lives are in danger. So our professionals need to always be ready and to help these women have access to the services that they need. And in order to do so, we need the funding. We need to be able to have competent staff, and we need to be able to retain this staff. And we need to be able to offer all the services that women and children need. That is why we need stable, recurrent funding. So not only in emergencies like COVID, correct? Yes. Thank you. And also, you mentioned the situation in Scotland once the bills were adopted. Could you tell us a bit more about what was done and the impact that that had, if you have any information on that? Was there an increase in reports? Was there an increase of incarcerations? If you could give us some information on that. England worked hard on that, and more recently Scotland. If we look at England, at the end of 2019 and 2020, there was an increase of 49% of cases linked to coercive control, and there were improvements made to the laws there. And there's almost 25,000 cases that were linked to coercive behavior in England. In Scotland, the new legislation is quite new from 2019, and in 2019-2020, there were almost 63,000 cases of domestic violence. we're not able to see an impact on femicides yet, but the pandemic did create an increase in femicides everywhere. So it will take time to see the impact, but if we look at England, there was a significant increase in reports. Now, I only have a minute left, so I might go over, but there will be a second round of questions. So for Quebec, that decided to create a special tribunal on violence and the federal government, there shouldn't be a difference in how things are handled. Can you give us any comments on that? We were happy with the changes on the Divorce Act, which had to do with coercive and controlling behavior. The interpreter regrets, but there was a connectivity issue. We want professionals to be able to detect things, and with a special tribunal, the professionals will be better trained, police officers, lawyers, social workers. We will be able to have a better idea of what women are going through. Domestic violence is not only a criminal act. Often there were many acts committed that are not necessarily criminal, but they create fear in women and it keeps them from being free. We need to take all of that into account.
Now move over. Our next 6 minutes is to Leah. Leah, you have 6.
Thank you so much, Chair, and thank you to the witnesses for, sorry, I'm just untangling my mask here, but thank you so much to the witnesses for coming today. You know, as you mentioned, we know there's a direct link between access to affordable, accessible housing, rent geared to income, which either allows or prevents individuals experiencing violence to leave. We also know there's a direct link between the ability to leave with income. You know, you spoke a little bit about income. One of the things that I put forward in this this current Parliament is a bill to develop a framework in support of a guaranteed livable basic income. With that in mind, without requiring participation in work or employment, thinking specifically of women who often are responsible for unpaid care work, for example, not requiring citizenship, for example, refugees, temporary foreign workers, permanent residents would also be eligible for an income. Would putting in place a guaranteed livable basic income assist women to leave violent situations?
Certainement, effectivement.
Of course, just knowing that women have the means to support themselves and their children, it would be very helpful in them leaving a violent partner.
Thank you so much. And just building on that, for example, individuals with precarious immigration status often don't qualify for programs. Does this impact individuals, women or diverse gendered individuals' ability to leave relationships because they are disqualified for certain social support programs? Does it limit that, their ability?
Yes, of course. This is one of the things which is really hard for women
immigrants. They don't know the country, they don't speak the language, they might not be fully integrated in the country yet. And also with coercive control, I mean, it says a lot about, the spouse or partner would say, well, you don't have revenue, you can't. So if she could be reassured that she would have the financial means to get out of this violent situation for herself and children, find affordable housing, it could be a big difference for that person.
Thank you so much for that. And I ask that because I know that even with the Canadian child tax benefit, certain, depending on immigration status, there's individuals that can't even qualify for that, which is concerning when we're talking about poverty as being a factor that forces individuals to stay in situations of violence. And within that in mind, I'm wondering, we know that organizations that provide support to women who are experiencing gender-based and intimate partner violence, that there has been some discussions about looking at providing services and programs from an intersectional lens to respond to different barriers that individuals or women or diverse genders face. Why is providing or using an intersectional lens so critical in addressing this issue for all women and diverse gendered individuals?
Well, I would say yes. We know that it is important to take into account all violence that women are suffering through if you want to help them to take measures to protect themselves. So this is essential to take into account various or specific impacts that decisions or programs might have on them. Now, earlier we were saying that if we go to criminalization of coercive control, what we wish for, we would have to take into account the reality of Indigenous women, which might be overrepresented amongst people in prisons and in many, because they might have used violence, even though they are victims.
Building on criminalization, so one of the questions I asked in the last panel is that criminalizing behaviors, we know that penitentiaries are riddled with antisocial and violence. How is placing people in situations of violence and, quite frankly, antisocial, how does it help resolve permanent or behavior and individuals' issues they may have with violence? Sorry, I was trying to condense it because I'm feeling rushed. Sorry. Didn't. So there you go. Thank you.
Well, I think I understand your question. What we're saying that when we call to use the justice systems with regard to violence, we need to send a clear message to society. Many spouses of women that we see in our shelters feel that, it's legitimate to use violence. And we need to send a clear message to the effect that these are behaviors that our society does not tolerate. And we need to find solutions so that they become aware and that they actually change. But we believe that we need to be very clear.
So much. So we're now going to move on to our second round. The only thing is we are getting very tight on time, of course, and we have about 2 minutes of committee business that we need to do. So looking at the time being 5:21 and having 8 minutes to do this, I'm going to ask each party to just put forward a question, okay? Of course, if it's a long question, you can ask for the documentation because I know that there's lots of things that we do want from that. So I'm going to pass this over and I'm looking at Leila. Leila, one question, if we can just recognize that we have 8 minutes for all the work to get done. Thanks.
OK, merci beaucoup tout le monde. Alors,
thank you, everyone. In order to criminalize coercive behavior, does there need to be physical violence, or is removing somebody's credit card considered to be controlling behavior. Thank you. So it's the accumulation with coercive control. If it's only one act, then that's probably not what it is, but often partners will use many different ways, whether it be threats or isolating the victims or economic means. So you need to look at all of those behaviors, which currently aren't criminal. So women who would want to report this, who want assistance, can't get assistance.
Sorry, fantastic. We're now going to move it over to Jenna. Jenna, who I stole all your time, you get a question. Go for it.
Thank you. So as part of our study, we're looking at barriers facing women that are seeking to flee their perpetrators. And we've listed specifically, and we've spoken a bit today about financial, social, coercive abuse, and immigration factors. So my question to you from your purview, what are we missing? What are the other factors that we're not talking about today that women are facing that we need to start talking about and address through this work?
Moi, je pense que quand on parle
I think that when we're talking to access to income, we also need to talk about access to jobs with fair wages. We want to encourage women to be a part of different workforces in order to have good income. We could also look at how workplaces can help women to get out of a violent situation. There's a campaign in Quebec called Allied Workforces, and we encourage employers to inform women and to support them if they need to take a leave. These are things that could help and remove barriers for victims who are attempting to flee a violent partner.
So much. Caroline, I know you've just joined us now. We have time for one question. So I'll pass the floor to you.
Merci, Madame la Présidente.
Thank you very much, Madam Chair. What I heard today was very interesting. And do the witnesses have any concluding remarks for women who are trying to leave a violent environment? How could some foreseeability assist women and help them feel safe when they try to leave? Answer: it could change their lives. It could make them safe once and for all. We're talking about financial security and safety, but we also talked about coercive control. So changing the legislation would support these women in leaving their relationship, and they would know that they would be receiving support. So receiving foreseeability and allowing women to know that they could receive assistance for themselves and for their children could help save their lives.
Pass it over to Leah for your last question.
Thank you so much, Chair. Just building on my last set of questions, you indicated that some individuals think they have a legitimate right to use violence, and that we clearly need to send a clear message that we do not tolerate violence. But my question is, how, in terms of incarcerating individuals who use violence, I'm wondering what the recidivism rate is. Like, how many people commit violence, go to jail, come out and reoffend? Like, are we actually resolving the behavior by using the penal system?
Écoutez, j'ai pas de statistiques, mais
I don't have any statistics, but for sentences, they're generally provincial sentences. So it's not a long period of incarceration. Usually it's probation and parole. So we need to continue looking at ways to assist these men in changing their behavior. I don't think we can say that right now most of them are incarcerated.
Thank Chantal and Louise for joining us today. It's been wonderful having you on this panel. I would ask you to leave, if you don't mind, from the meeting. We do have about 2 minutes of committee business. So thank you once again from all of us. Thank you. And thank you so much, everybody. Thank you. I know it's really hard when we're on our time crunch, but there has been a person that has come to the attention of the clerk who would like to put forward a brief. The only problem is the person is not able to do a written brief. The clerk has offered, with her willingness, is to actually take the phone call, get it all written down, transcribed, done into both French and English so that we have a copy of the brief. I'm just looking for the support from the committee, and is there anyone not in favor of that, I should ask? Anyone not in favor? Happy, joyful. I believe that you, clerk, you have the grounds to go ahead and take that brief. Okay. Just thank you so much to everybody. I know it's been a little goofy and it's a little hard. As you know, our time is committed from 3:30 till 5:30, and because there are other meetings going on and all of those things, we'll just try to, as soon as, if there's votes, let's just get to work as soon as we can once everything is done. I know that we have awesome witnesses coming forward, but on behalf of everybody, on behalf of the people in the room, thank you so much to all of you guys for being great committee members, and we will see you again on Friday, 1:30.
You're a rock star, Chair.
Okay, bye, guys.